International Nurses Week. My name is Edidio Martins and I'm so excited to be a part of this year's edition of Health Awareness, brought to you by Health Circumference and Renewed Fertility IVF Clinic. Thank you so much for making this episode a possibility. So I'm just going to write straight into why I am here today. Today I'll be talking about healthcare access. Healthcare access. Is that even something we should talk about? Yes, it is. So what is healthcare? Simply put, healthcare is an organized medical care given to an individual or a community. Mark the word organized. So you don't just walk into the hospital, oh, I'm having a headache, and they say, okay, take paracetamol. No, it is organized. It has a process and it is carried out by professionals who are healthcare providers, people who are trained and licensed by recognized bodies like the Nursing and Midwifery Council, like the Nigerian Medical Association, like all the recognized bodies trained and licensed to practice. We have pharmacists, we have nurses, we have radiographers, dentists, doctors, name them. Those are professional healthcare providers. Why should you accept or access healthcare? What are the aims and objectives of healthcare? I'll just mention three major aims and objectives of healthcare: preventive, curative, and healthcare prevention. Why am I saying preventive? Why should you go to the hospital? I'm having a headache, and you feel it's just a headache, I don't need to do anything about it. No, that headache could lead to something fatal. That headache could cost you your life. So you go to the hospital to prevent this headache from going from just headache to maybe chest pain or heart failure or even death. So yes, preventive or prevention is why you should accept or access healthcare. Curative purposes, while some medical conditions can only be managed, there are some that can be cured for life, and which is why you should go to the hospital. Health promotion, like what we are doing, we're bringing information to you on YouTube, Facebook, televisions, radio, in the hospitals. These are the major aims of health care. Who are healthcare providers? Like I mentioned earlier, people who are trained and licensed to practice. Why am I stressing trained and licensed to practice? Because there are other people we call quacks who are not trained, recognized by the government, but are out there practicing without a valid license, and you should run away from them. It's one thing to say I am a nurse, it's another to say I am licensed to practice. Who is regulating my practice? Who am I answerable to? If something goes wrong with a patient, who will I run to say, oh, I made a mistake, can I get help? No, you still run back to the professionals and stress us the more. So you need to run away from these quacks, please. What are the dangers of delayed healthcare access? So there is a model that classifies it into three phases. We have phase 1, phase 2, and phase 3 delays. Phase 1 delay is seeking care. It's one thing to feel uncomfortable. It's another thing to say, okay, this discomfort needs to be taken care of. Or I have identified a problem in my body and I need to go to the hospital. The time you take in making this decision is very important. And the longer you stay in taking this decision could be fatal. So time is very important. The longer you delay a process, the worse it could become in some cases. So it's very important that you identify a problem and make a quick decision to access healthcare, because it's really dangerous to delay. The second phase of delay is reaching healthcare. These delays could be caused by poor route network, inaccessibility to the health facility. Do we have functional ambulance or emergency services that, oh, I have an emergency, I need to get to the hospital, but I do not have any means of transportation, and they are okay, send us your location and boom, they're there. No. How bad is your road? Do you need to travel by sea, by water? Do you need to walk? Is it motorable? All these things could cause delays and are very, very dangerous. What role can the government play in optimizing healthcare? Funding is very important. You need to fund the hospital, equip the hospital, equip the staff, pay them what they deserve so they'll be happy to work. How many hospitals do you have in your local communities? How functional are they? These are ways governments can help to optimize healthcare, make the process work, come out with policies that helps patients who come to the hospital and they can access quality healthcare, not just coming to the hospital. This hospital operates this way, the other hospital operates that way. No. Make it accessible, make it affordable, make it available for everyone. These are ways government could help to make the healthcare system better. Okay, so there are so many things to be discussed. There are so many things one could talk about healthcare access, but time will not permit me to go into all of them. And I would want to encourage you as much as possible. Like, I know nobody wants to be sick. Trust me, nobody wants to be sick. But make it a habit to decide in time that you need a doctor. Don't just wait until it gets to the point where you cannot do anything about. Go to the hospital before it is too late. Time is very important, and I don't want you to waste much time. The next time you feel uncomfortable, the next time you feel any discomfort in your body, run to the hospital. If you can access it easily, please go to the hospital. All right, we're here to care for you, we're here to treat you, we're here to give you all the care that we've been trained to give. Okay, see you some of the time next year, and I'm so happy to bring this to you and hope to see you next year in our next edition celebrating International Nurses Week. Shout out to all the nurses out there. Thank you for all the amazing work you do. I love you, and bye.